welcome to our first Overlife for 2020. I'm Runsi Sen, the founder of Overcome, and today I'm joined by Dr. Judith Smith to talk about nutrition and nutritional supplements in ovarian cancer recovery and chemotherapy and cancer recovery. So Dr. Smith leads the Women's Health Integrative Medicine Research Program at UT Health and is considered a global expert in this field. So grab a chair and join us for the conversation for the next 20 minutes or so. And if you have any questions for Dr. Smith, please type in the comment section below, and after our conversation is over, Dr. Smith will get to you with those questions, and we'll make sure that we are addressing them. So with that, thank you so very much, Dr. Smith, for joining us today.
Thank you so
much. It's an honor. So we have so much to discuss. I'm just going to delve right in. So in terms of dietary supplements, what should we know about them and while considering using these supplements as part of the cancer treatment? And also, tell us a little bit about the risks and the side effects of supplements that we should be aware of.
Okay, so that's a big question, so we'll try to break that apart. First, with any nutritional dietary supplements, I think it's very important to communicate with your team, because there are supplements we do actually recommend, it's on our patient education, that you should be taking that may help avoid or minimize some of the side effects associated with chemotherapy. But then, like in our research program, we do a lot of research here to determine which supplements may not be the safest idea. And so it's really important is communication with your team to make sure. So when you are using dietary supplements or nutritional supplements, it's always important to make sure you're using a reliable product that has been manufactured under good manufacturing practices. And there's a lot of history in the supplement industry that it has some bad reputation, that the FDA and the FTC have worked very closely to help get products to be safer for our consumers today. So a lot of the laws and rules changed in 2008, and so that today, nutritional supplement companies should be following good manufacturing practices and should have availability on their website to tell you that they are following those standards, that their lots are reproducible, and maybe avoiding some of those supplement companies that are from out of the country that are not held to the same standard. If they're not based in the U.S., they are not required to follow those standards. So, and for my patients, I usually tell them to show me what they're taking, and I just make sure that it is a reliable source from what. That's one of the most important things for safety purposes, and to make sure it doesn't interact with the chemotherapy. So, communication is the key in that equation.
Yeah. So prior to starting your supplementation routine, you should essentially speak with your doctor or your healthcare team to make sure that they are on the same page on the information, right?
And absolutely, and even when you change regimens, some of those recommendations may change based on the chemotherapy you're on, and when you can and can't take supplements, because there are a lot of supplements that you should be on even if you're not on chemotherapy. Well, we can talk about some of the ones for recovery that can help enhance that nutritional foundation, such as for like oncology cancer patients. I always recommend that while they're on chemotherapy, they are on a multivitamin, for women specifically with iron, because most of the gynecologic malignancies specifically have a lot of bleeding associated with them. The chemotherapy is very hard on our bone marrow where the hemoglobin comes from. We also definitely would want patients on a calcium supplement, because the chemotherapy basically steals all the calcium from your bone, and so you can lose your bone integrity. So that's really important. And then helping support the immune system. A lot of the supplements out there that help support immune system are what we call free radicals or antioxidants, and those do interact with chemotherapy. So we don't want you on high dose vitamin C. We don't want you going out and taking some of this specific herbal nutritional products that are targeting to boost that antioxidant activity. So we use things like omega-3s that have head-to-toe benefits that help boost the immune system, probiotics that can help boost the immune system via the gut, and have no interaction with the chemotherapy. And immunity is really important during chemotherapy because you're at so much higher risk for infection.
Yeah. So, in terms of common misconceptions, right, about dietary supplements that we should know of, what would be your guidance on that, and when duplicative side effects exist between supplements, taking supplements and going through chemotherapy, like nausea? In that situation, what would be your guidance to survivors and patients that are considering supplementation?
So I think when our friends and family recommend specific supplements, the best intentions are in mind.
Mm-hmm.
And sometimes starting a new supplement that your body isn't used to, if your stomach is sensitive and you're also a little bit more sensitive from chemotherapy, that's where the extra nausea can come from. We typically, again, want you to talk to your team, and I think a big misconception out there though is that patients think, oh, my physicians are going to tell me everything is bad and I shouldn't take anything, and I can't promise you that every physician won't do that, but we've worked really hard over my career. I've done a lot of educational opportunities with physicians and nursing and pharmacy to show the safety of the nutritional supplements, and making sure that they are safe. And everything on the internet is not always true, so there's a lot of accolades and anecdotal reports that you really I know want to believe and think, oh, well, it helped them and it's going to help me, but sometimes it's just best to make sure that there's not a drug interaction going on there. Sometimes they're decreasing the side effects of the chemotherapy because they're also decreasing the efficacy of the chemotherapy. Right. So that's where you've got to watch out for. So that's where a lot of the misconceptions go. Well, she did okay, then I should be okay, but your metabolism, the drugs you are on,
every patient is unique,
different,
right.
And so your friend who had breast cancer was getting completely different drugs than you are getting as an ovarian cancer patient.
Mm-hmm.
And so what was okay for her to take may not be what's okay for you to take, and that's where we do want to individualize the supplements we're recommending based on what chemotherapy you're getting and what's going on with your tumor.
That's very valuable advice. Thank you so much on that. In terms of nutrition or dietary supplements, when we are choosing, you just made a segue into this question. So, which of these supplements are the best for a survivor or a patient going through treatment during cancer, and what are the foods or nutrition that we should avoid and why?
Okay, so what is best, and what it definitely for while you're going through chemotherapy, but especially in that recovery, is adequate protein supplementation. And I think generally as a society, we don't consume enough protein. A lot to do with a lot of the new diet fads too, that people are starving their body of some of the protein sources. But the protein is like the backbone for cell recovery. So your body can't rebuild itself without adequate protein resources. And the average adult needs 50 to 60 grams a day, but if you're in the cancer recovery, that really goes up to closer to 100 to 120 grams a day, which isn't easy to consume through your daily diet. So that's where a protein supplement would be really helpful, and that's what we try to encourage our patients, especially during chemotherapy when your appetite may not be as strong as always, like those protein supplement shakes or bars. Taking an additional protein supplement is really helpful to kind of try to get close to that bar, which is difficult, but in the recovery after chemotherapy, for sure, to continue that. Maybe not for a lifetime, you don't have to stay at that 100 grams, but at least for that first 6 months till your body is back to feeling 100%. And the big one to avoid is the antioxidants, as I mentioned earlier. There's a lot, especially for our patient population, that deals with surgical menopause. So even if they already went through menopause, they get almost a resurgence of menopause, which gets very frustrating. Because like, wait, I already did this, and now I'm getting menopausal symptoms again. Because even natural menopause, you still have low levels of estrogen, and then we surgically remove it. Not me personally, pharmacist, but it's surgically removed, and they get that surgical menopause as well. And so a lot of patients reach to natural products. And so phytoestrogens is a class of nutritional supplements that have lots of anecdotal reports and literature, and there's certain ones that are safe. We really delved deep into this in our lab since it affected our patient population to see which ones actually bind to the estrogen receptor and which ones maybe are not. And so maca root is one that we have done a lot of studies all the way through animal studies, and I have my patients taking now, and I can say it works. It's safe, it doesn't bind to the estrogen receptor, so it's a good alternative to taking hormone replacement itself if that's not a good option for the patient. So those, but some agents that are like kava, which has been shown to cause a lot of liver toxicity, that's very unpredictable, may not be a great phytoestrogen to be taking. So checking on the safety profiles and making sure you're sticking to what is going to be safe for you in the long term is important.
And going back to protein, because I'm personally interested in that as well, natural sources of protein, what would you recommend? I know that, you know, we can supplement to get to that 100, 120, but if there were good natural sources of protein as well, what would they be?
So ideally, we do prefer more of animal sources of protein, but understanding and appreciate a lot of vegan diets now that there are some really good plant sources like pea protein that are in a lot of the shakes as well, but the plant sources are as well. It's just recognizing that when we give you an estimate how much protein you need, if you're getting it all from plant sources, you actually need to increase that even a little bit more. And so if it's you're going vegan to actually try and reduce calories, that might end up being unbalanced because you have to eat more to get the adequate protein, or using a protein supplement in addition to the protein sources. So the dairy products also have a good source. You know, it's again animal derived, but the whey protein is very good source of protein as well. It doesn't actually have to be a steak. It doesn't have to be chicken, but eggs are a really good source of protein as well. And then your nuts. Your nut family is a really good source of protein and good for the GI tract as well. So, you know, trying to do your due diligence. There's great websites that really break down the protein content in all of the plant products and the animal products so that you can kind of figure out what best for your diet balance to reach that goal.
Should we focus on organic food in this whole journey of nutrition and supplementation, and what is your opinion? Because we have, you know, received this question from our survivors way too many times than we can actually possibly address, is does sugar intake during chemotherapy and recovery, you know, impact your...
Two separate questions there.
Yes.
First, our organic foods. Those of us in the nutrition field feel that there's a little bit of misinformation out there, is that the organic foods still do have organic pesticides on it. So the reason of whether a chemical pesticide versus an organically derived pesticide is going to be safer, we really don't have data to substantiate that. So, and it kind of goes into the same concept of the GMO craze as well, that almost all foods have been modified to some extent. So I'm not sure if the data is there to merit those recommendations. Eating fresh foods, not processed foods, is really, whether they're organic or not, I think not processed foods are if we can strive for that. Of course, I know that's more expensive, but you know,
and it also takes more time.
And it takes more time because you have to prepare it, but or you need to go buy it, and that's a lot from a social perspective. We're trying to work with the food industry itself to bring some of the cost of fruits and vegetables down or subsidized so that people can eat healthy and not have to have some major food income to meet those standards. So I wouldn't put as much emphasis on organic as I would say not processed. If we can avoid processed foods, or minimize, I won't say avoid, minimize processed foods. Now, sugar is one of my favorite questions because there's a lot of data out there and there's a lot of information on the internet that concern patients. And I just had a patient in clinic last week who was like depriving herself of dessert because her family said it was going to make her cancer grow. And Honestly, we do a lot of animal studies, and my best analogy is if you think of all of this sugar data, none has been validated in humans. It's all animal-based data that says sugar causes cancer. Sugar does cause obesity, and obesity,
which could be linked to
obesity, yes, will give you cancer, because there's a lot of silent inflammation and insulted pathways that cause cancer. So obesity, no doubt, no question. And sugar, eating too much sugar will make you fat and will definitely contribute to obesity. And obesity is definitely the number one risk factor for cancer these days, almost head to head with tobacco. So, but however, just eating sugar alone in moderation isn't supported by the data. So the amount of sugar that they gave those rats and animals would fill this room.
Oh my gosh.
And if you took an equivalent human dose daily, and I don't think anyone could physically eat that much sugar every day on a continuous basis. Maybe once. Like, I've seen those hot dog eating contests, and I still can't fathom how they do that. So I was like, I won't say you could never do it in a day, because maybe you could do it once, but you certainly aren't. You're probably going to diabetic coma in the process, because your body can't process that much sugar. So that's where, we joke in our lab, because the rats and the mice that we use to do these studies, like, they live on trash and in nature, an evolutionary pattern. So we can give them a lot of anything. And we always say enough of anything will give you cancer, and enough of anything will cure you of cancer. It's just whether or not it's relevant to us as humans. Like, can we consume that? And that's why, even with the nutritional supplements that are curing cancer, or supposedly curing cancer, and those based on those animal data, you have to, and it would be hard for someone outside of medicine to figure this out, but the question is, can I consume that much in my body size that's equivalent? And that's where we really focus on that in our lab to make sure when we're using supplement studies, it's that the dose is able to be taken as equivalent to a human dose, but not always the case. So sometimes all that data you see out there on sugar, or whether it's supplements, it may be not relevant because it's all animal data. So take animal data with a grain of salt.
That's great advice. And so from the prevention standpoint, we talked about sugar's role in cancer. So for a survivor or a patient that is going through chemotherapy, we have had those conversations with our patients where they are not sure as to how much sugar intake is good or is okay. So to your point, they starve themselves from that nice little cupcake that they have always wanted to have since recovery and the treatment. So when they're going through the chemotherapy treatment, what you're saying is sugar in moderation, even in those like active treatment phase, is actually okay.
Absolutely. And it's almost may help them, because often these patients are getting hypoglycemic as well.
And also it makes you happy.
It makes you happy. Mental status is important in mind over matter. So it's moderation is the key word. We really honestly don't want patients to deprive themselves of any food group. Not that desserts are a food group in itself, but they really shouldn't be depriving themselves of whatever sounds good when they're going through chemotherapy, because we want them to eat. They need that nutritional intake to maintain their energy levels, to maintain their hydration, because when you eat, you drink, and if you're not eating, you may not drink.
Sure.
And the hydration is really important for protecting your kidneys, for chemotherapy, and always. So moderation is a key thing on that, and not depriving yourself.
So when you are going through chemotherapy and surgery, from what you have seen in your patients, what are the common eating problems that they experience that you think, and what are the benefits of good nutrition to address those problems?
So one of the, both in the surgery setting as well as during chemotherapy, a lot of the medications we're giving you are making you nauseous, but not nauseous enough to be throwing up. So a lot of patients think that loss of appetite is just not wanting to eat, but that's really the first sign of nausea, and actually taking the nausea medication may help alleviate that, because eating healthy helps with recovery. Our body needs the protein, it needs the carbohydrates, it needs the electrolytes and the sugars to all work together to help with cellular repair and to maintain blood flow and blood regeneration. So not eating during chemotherapy can be detrimental. So that's why we really want to make sure they're eating a well-balanced diet. So making sure the nausea is under control. And as far as supplements during surgery, that's another thing you really need to make sure you're aware what the physicians are aware what you're taking, because there are certain ones that have natural anticoagulants, which means that you won't clot as well during surgery. You may bleed more if they don't realize you're on that. So a classic one is the omega-3s, which I think are a phenomenal supplement. One of my favorite supplements for everyone to be on, but not during surgery. So 14 days before, and can't restart them until 7 days after, when we know you're like out of the bleeding window risk, and then you can restart them. So that is really important during surgery. Surgery, the protein intake is even more important for surgery recovery. So, we were talking about, the normal protein intake. Even if you're just getting surgery, you need to increase that intake, again, up to that 100, 120, to make sure that you can help with that repair and get back on your feet and ambulating quickly. And then staying hydrated, I think, is the thing we all drop the ball on a regular basis. It doesn't have to be water alone. It could be the electrolyte drink of du jour, of whatever one you like. It can be water with fruit in them, the fruit fusion drinks. We just, caution if you're drinking caffeine that you don't count that as your hydration for the day, because it's a diuretic in itself, and so you're losing hydration. So, but by no means that some patients take that as I can't drink caffeine. You can drink caffeine, you just need to also be drinking water or other non-caffeinated beverages.
Great. And what tips would you give as for sustainable healthy eating after the cancer treatment, and what would be your guidance on alcohol?
So, might surprise you, but part of healthy eating requires getting adequate sleep. Because the more sleep deprivation you have, the more your body will hold on to calories, and more hungry you will be throughout the day because you didn't get adequate sleep. So part of the recovery and getting back to healthy lifestyle is adequate sleep, and
which is 8 hours?
At minimum 6. 8 is ideal. For an adult, it's 6. For a child, it could be anywhere from 10 to 12, depending on the age of the child. 8 is ideal, but it's hard to strive for, so we say at minimum the 6. There's data that say you decrease your mortality by 10 years for every hour less of sleep you get a night, so or something like that. I can't remember the study off the top of my head, but I know less than 7 hours is where they start to see the drop off in mortality. So adequate sleep, and then eating regularly, not skipping meals. You can eat lighter meals more frequently rather than 3 big meals a day, which is a lifestyle change. Often get implemented during chemotherapy because they can't eat those big meals. But it is actually healthier for your GI system to eat smaller grazing rather than big meals a day. And then maintaining all food groups as best you can. And if they are vegetarian, then making sure they're getting more protein from those plant-derived sources, and correcting for that decreased protein intake from other sources.
Okay.
You had another
question. Your guidance on alcohol.
On alcohol, it really depends on how the chemotherapy affected your liver and your kidneys, both, and where you are in your recovery window. During chemotherapy, I think alcohol can really make it a little bit more challenging for your body because it can make you more nauseous. It can cause drug interactions. Alcohol increases metabolism, or what we call induction, or induces metabolism of a lot of drugs, so probably don't want that going on. And it can affect your kidneys and dehydration. It makes you more dehydrated, generally. Creates dehydration state. So if you're not correcting for the increased hydration, a glass of wine or one alcohol beverage is not going to be a huge concern, but probably not on a regular basis, maybe intermittently. I know we just finished the holiday season, so of course we're like, of course, at a holiday party, or but in moderation, just maybe one drink if you're on active chemotherapy. once you recover from chemotherapy, I give your body time. That first 3 months, you're still kind of like in that infant stage of recovery, and even up to 6 months, depending on what we gave to you and how hard the chemotherapy was on your body. And then just making sure your labs are all looking good, you're feeling good, you're getting adequate sleep, then resuming your normal alcohol intake in moderation is okay. It's not directly linked to causing any change in your risk of a recurrence, as long as it's not in an extreme.
Okay. This is the flu season, so I do want to know from you in terms of patients or survivors that have not only just finished their treatment but are also maybe going through chemotherapy, have had their surgery, or in the active treatment phase. So what should they know about the vaccinations and the flu season in general? How should we protect ourselves, and any other guidance that you might have for us?
Yeah, so flu season is a challenge for our patients on active treatments, because typically the vaccines come out in August, early September, and we recommend vaccinations now all the way through February, because the flu season is lasting longer and longer. When you're on chemotherapy, your body doesn't always mount as strong of an immune response. So what the guidance and the data all recommend is it has to be 2 weeks before your next cycle and 2 weeks after your last cycle. So if you're on a Q every 3 week regimen, you can't get the flu vaccine because there's not a 2 week window on both sides, which is most of the regimens that we give for ovarian cancer tend to be every 2 weeks or every 3 weeks. We only have a few that are every 4 weeks, and those patients, it's like right in the middle of their cycle, they may be able to get the flu vaccine. And there's not a safety issue. It won't hurt you, but it just won't give you that full or even partial immune response. For patients after they finish chemotherapy, absolutely the flu vaccine is probably a good idea, because your immune system, although you're back to 100%, may still be a little bit weaker, and we don't want you to get sick with the flu. We generally recommend everyone get the flu vaccine. We're all required to get the flu vaccine in the healthcare arena, and I know there's some controversy around it, because right now, even this year, like, oh well, everyone's getting influenza B when it only covered influenza A, and the CDC does the best they can trying to predict what is going to be the most prevalent flu. So other things you can do to prevent getting the flu, even in the face of the vaccine, can't cover everything. Good hand washing. I think we forget about that in public sometimes, like looking at the door, because how many germs are on that door handle. If we swab that and grew that in the lab, it'd probably nauseate most people will be like, oh my gosh, look how many. So I keep antibacterial gel with me at all times, and just using that, washing your hands definitely before you eat, and even after you eat, just to kind of not spread your germs now to anyone else, and not to be rude to the public, but hugs and kisses during flu season is probably not a good idea, because none of us know, like, oh,
that's a good point.
That little headache I'm getting is actually the first sign of the flu, that for me. And so, and now I was just at a party and I hugged everybody there, and so I kind of, now they all get the flu. Fortunately, not quite as contagious as the chickenpox used to be, which is kind of an unknown thing now these days, because that vaccine worked really well. It kind of wiped it out for the most part. But yeah, so good, just kind of not becoming a germaphobe, but just kind of using some common sense that it's more people are likely to have colds and flus in this time of the year. So, and if anything, if you do go to parties, or even when you come home from work, to kind of get in the habit of taking shoes off when you go in the house, so you don't drag all those germs into your home, changing clothes, so that whatever you did pick up at work or at the party doesn't then get transmitted all over your home as well. And then trying to break the habit of touching your face, which is super hard. But just making, because we've done, there's a lot of studies out there to show how commonly we touch our face throughout the day, and that's usually how germs are getting from our hands into our mouth, into our nose, or into our eyes, and spreading the infection.
Thank you for the great advice. And my final question, what would be your message to our survivors and care partners and all the overcomers that are watching or will be watching on starting up the new year and the new decade on a healthy and nutritious note?
So there's lots of advice for 2020. One of, I think for women specifically, because we multitask so much, the amount of stress we put on our lives, we don't even notice. I think women are just tolerate stress a little bit better than some of our counterparts. And so those nutritional supplements can help you stay healthy. So things like the omega-3s and probiotics also decrease what stress causes, which is silent inflammation. Silent inflammation increases your risk for cancer, increases your risk for cardiac disease, increases that obesity factor that is not can contribute to both of the above, but also just a lot of women just fight and struggle with weight loss all the time. And so that physiological stress can really be counteracted by good nutrition. So the omega-3s, the probiotics, the multivitamin can help make sure you're getting those requirements, adequate sleep, some form of exercise, and I don't mean you have to go to the gym, just whatever incapacity if you're doing, if you can incorporate 15-20 minutes a day.
Just staying active.
Staying active, whether it's just going for a brisk walk or it's going to the gym, but also taking this a mental break. I'm calling it my 2020 mental break, for taking 20 minutes a day just to stop. And especially as I feel that women tend to be the ones facilitating the care of everyone else, whether it's our immediate family or extended families or our coworkers or et cetera, the community. We tend to be the caretakers to take care of yourself first, because that's generally where good health starts.
Thank you so very much, Dr. Smith. This was like really good information, and it's so easy to understand, and this was fantastic. So thank you so very much. Thank you all for watching, and please be sure to share the copy of this great informational discussion onto your page so that more people can benefit from this information. And like we talked about, if you do have any questions for Dr. Smith, be sure to send us a message or type in the comment section below, and we'll make sure to get this across to Dr. Smith so that we can get this answered for you. So thank you very much, and we will see you next time. Bye.
Thank you. Take care.